Mr. Andriukaitis, thank you very much for the opportunity to talk to us young Easterners, and especially on the topic on the brain health. So my question to you is, what do you think European Union, European Commission or institutions in general can do to really help tackle the issue of the neurodegenerative diseases towards better brain health in Europe?
First of all, we need to say very openly, we need to include it into European agenda, into European Commission agenda, because as you see till now, brain health, that's common understanding of neurodegenerative diseases, is very complicated, and no one is capable to include it into broad context of brain health. And now mental health is on top, mental health. But nobody is concentrating that its mental health covers also a small part of brain health as a whole. And what we need now to send very clear political message that brain health should be included into programs speaking about more general view of European Health Union. It is not enough now to say that, oh yeah, look, we came with Europe is beating cancer, okay, we are coming with cardiovascular disease plan, okay, maybe we will see in the future something. Going from program to program, never covering much broader picture of all diseases. You do very difficult job. You are segregating some people. Some people suffering from some brain diseases, they feel that they are neglected. We need now to say very clearly, brain health should be part of broad concept, brain health, mental health, together. And we need to do our best at European Parliament level, at Commission level, at Council level. Of course, at Presidency Council should include brain health into agenda.
Thank you very much, and couldn't agree more with you. We as young health enthusiasts very much share your opinion, and we want more action and more political commitment towards tackling brain diseases, but health more broadly as well. So thank you very much, Mr. Andriukaitis.
Thank you so much.
Mr. Andriukaitis, thank you very much for your time. I think you are in a unique position. You have served as a Minister of Health, as a member of the European Parliament, and also, of course, as a Health Commissioner. Over those years, the EU has really done more and more in healthcare. We've seen significant revisions of legislation. We've seen the EU deliver very important plans for diseases, Europe's Beating Cancer Plan, and soon a cardiovascular plan coming up. At the same time, we also see that the EU is facing increasing competition and innovation from other regions, specifically the US and China. And we also see that there is a trend of declining clinical trials, which is of course concerning. I would like to ask for your views and how do you see the way forward? Do you see the EU continuing to do more on health? Are you optimistic about what's coming next?
It's not more on health. We need to say very clearly. Now the main challenge is, when we are speaking about European health issues, is fragmentation. And of course, a lot of issues are disseminated in different levels, some at member states levels, some in programs, but no one is looking about possibility to build together all ecosystems which can allow us to be more faster, more targeted in area of clinical trials, of orphan drugs, medical devices, and so on. We need now as never before to say European Union should keep powers back. It means that they keep powers from other continents to strengthen European autonomy in medical devices, in drugs, in diagnostics, in new technologies, in clinical trials. What we need to build pan-European ecosystem which can allow us to be more faster in clinical trials, to create legal frame which should be much more easier, much more simple. Because what we need to harmonize our work at EU level together with member states level. It's not controversy. Speaking about necessity to have pan-European ecosystem and pan-European infrastructure which can guarantee free movement of research, investment and innovations together with areas of member states. It's not confrontation, it's supplementation. They can supplement each other, build cooperation and to show European readiness to be global leader in clinical trials, to be global leader in treatment, to be global leader in technologies. We need now to keep momentum because this momentum is up to us.
So you took reference from the LETA report. I fully agree with you, and thank you very much for your time and your experience.
Of course, please keep in mind, LETA report, Draghi report, Manuel Hayter report, Niinistö report, all those reports can help us develop pan-European infrastructure for research, investment and innovations and producing our drugs, medical devices, technologies and selling it globally as made in Europe.
It's critical time to deliver. Let's see where we are in 1 year from now at the next edition of the Gastein Forum. Thank you very much for your time. Thank you.
Bye-bye.